sunny day and your pupil's stuck wide open, that's going to give you a headache, okay? Blurred vision, increased sweating, difficulty falling or staying asleep because it's overfiring, it won't slow down, okay? Heart palpitations and increased heart rate. Whenever the brain doesn't work right, it will give you palpitations, dysrhythmia, and fast and slow heart rate. You may go to the doctor, he may diagnose you with those things, but they never know where it comes from. It comes from the brain, okay, when the brain doesn't work right. Irritable bowel, yes. Anyone who knows anyone who's been diagnosed with fibromyalgia, their first job when they go into a restaurant is locate front door and the bathroom. Because they know that whenever they eat, they're going to be running, they're going to have that got to do it right now moment, and they're going to be off somewhere. And a lot of foods will do that to them, and probably the gluten. Coffee's a big one, and probably because it's the cross-reactive food. Urinary tract infections, because when that brainstem or the upper mesencephalon overfires, it makes the sphincter in the bladder clamp down, and then the urine can't void all the way. So you'll have that little bit that's left at the bottom where stuff just grows in there, okay? And you'll take the antibiotics and it will go away, but the problem's still there. So they come back over and over and over again. You never get rid of them. High blood pressure and fibro fog or flu-like symptoms, okay? All extremely common. Does this sound like fibromyalgia? It's basically, you had someone with fibro, they have like all those symptoms. And what they have is a brain that doesn't work right. So the other thing that you can see is you have episodes of depression or anxiety, and again, depends on what side of the brain. You see more depression on the left side and more anxiety on the right side when it's dysfunctional. Difficulty scanning pages, adding, subtracting, finding words. You get them on the tip of your tongue. Loss of short-term or long-term memory. Sensational changes in your hands or your feet. Can be a parietal lobe problem. We see that a lot. Being just more irritable or angry, and that has a tendency to be usually more right brain, and it has to do with neurotransmitters as well. Problems with balance, tripping, dropping things. Cerebellum controls your those type of activities, balance and whatnot. Learning disabilities, mostly a right brain thing. Okay. The unfortunate thing about the right brain dyslexia and ADD of the youth, they end up being drug and alcohol abusers later because of that dopamine deficiency. But that's a whole other class. So when we look at the brain needs two things to be successful in its job. It needs fuel and activation. Fuel is glucose and oxygen. So if you have bad blood sugar regulation, diabetes, you're not going to have good. Brain wants a good steady fuel supply. It doesn't want this. Okay, and if you're having to take medicine to regulate your blood sugar, it's not this. It's still this. Okay. Oxygen, if you have any kind of anemias, which are very common in people who have chronic illnesses, that's a major fuel of the brain too. Okay, you got to have it. If your brain is lacking in either two of those things, you're not going to be healthy and you're not going to be well. It's not going to be able to do its job. It's not going to be able to work right. Okay. Activation is anything that's going to stimulate the brain to work. All right. Because your brain can't be healthy in a vacuum. It has to be consistently activated or it dies. Kind of like a muscle just wasting away. So what we find is that when you can take the neurological breakdowns and the metabolic complications, which are just kind of this array of just chaos and bad things happening inside your body, and you start to figure out where the problem is in the brain, you can localize it, you figure out where the problem is metabolically in the body by doing the testing. When you correct the misfiring and the metabolic dysfunction, then everything just kind of comes together and fits like it's supposed to. And when we do periodic retesting, we know that you're on the right track. And by doing that, what we're doing is we're treating the whole person. We're treating the whole body. We're not just treating one little piece of it or using one marker to do our whole treatment on. So when the person is well, what we'll see is that the cortisol levels normalize, the blood sugar will normalize as well. The hormones will balance out, the oxygen will be better. the midbrain and the cerebellum will be functioning at a better level as well. And when you have all those things working right, you're going to feel better, no doubt. So, I only accept a very few, but you know what, before I get into this, I only accept a few patients a month, up to 5, for thyroid disorders, just because they're so complicated to deal with. And I don't know if any of you have been in the chiropractor before, but we don't do like a 2-minute adjustment in this office where you get thrown on a table, we jump up and down you, and then we send you away. That's totally not where I'm coming from. We do intense neurological work. We use oxygen therapy. We do metabolically. We look at you every time that you're in here. We look at your diet and things like that. So when you're here in the office, you're here for an hour to an hour and a half, usually, per visit, because that's how long we need to see you. So we're offering you 2 visits for $79, which is a huge savings off what we would normally be charging just for the evaluation. And what that allows me to do is get some information from you, sit down with you, and find out exactly what it is that you have going on and whether or not you're a good fit for the type of program that we have. And again, if I felt like I couldn't help you, I'd give you your $79 back. If I felt there was really something that I couldn't help you with, because I don't want to take someone I don't think I can help. Before I get into this, though, I need to switch up that PowerPoint, because I didn't want to go there quite yet. I wanted to go through some of the testing that we do, because that is really what sets us apart. And once I go through it, it's going to make more sense to you. So let me touch on this, some of the other autoimmune disorders that you may not be familiar with. So I'm going to run through those, because when you have an autoimmune disorder, this is what you have to look forward to, because if you don't fix it, your body is going to find something else to attack. So whatever that is, whether it's sooner or later, it just depends on the health of you. Rheumatoid arthritis, Sjogren's, lupus, you have that rash on your face. Scleroderma, Hashimoto's, which is the thyroid, hypothyroid, Graves is the hyper. Multiple sclerosis is an autoimmune disorder. That's the brain of the spinal cord, the myelin sheath. Celiac disease, the gut, autoimmune disruption from wheat is very common, or at least the gluten sensitivity. Myasthenia gravis, which has to do with the muscles. Raynaud's, type 1 diabetes. So all of these things are the outcome of an autoimmune disorder problem that is just running amok because you're not fixing what's creating a problem with the immune system. Okay? So, and again, what we do differently here is we treat you metabolically and neurologically. Okay? And the only reason that you're here is because you have a chronic health condition that you're obviously, whatever treatment you're doing for it, it's not really working for you. Okay? Or you wouldn't be here. You'd be happy at home watching some American Idol on tonight. What's on tonight?
I don't know.
Thursday? I don't know. I think that was last night. I watched it last night. So, no stone is left unturned to determine the exact cause of your condition. We do a variety of testing because we don't want to miss something that's causing the problem, okay? And by using very specific testing, that's how we find out what you need to have done. So, some of the treatments that we do, or some of the lab panels that we use, are blood tests, where we do a complete thyroid panel, okay? Where at minimum, with a thyroid patient, we're going to do TSH, total T4, total T3, T3 uptake, and when I see the preliminary results, I may add other tests on, depending on what they look like. Complete metabolic panel, a lipid panel, which looks at your cholesterol and things like that, and if I saw 70, I'd fall off my chair. I haven't seen one that low yet. Complete blood chemistry with autodifferential, and what that does is it breaks down your red and your white blood cells. The red blood cells getting broken down is going to show me anemia patterns. The white blood cells being broken down is going to show me infection patterns. And it's going to point me in the direction of what you have going on. Parasitic, bacterial, it can kind of point me in a direction. It's not going to be definitive, but it's going to show me which way to go. So we assess all of these different organs by looking at the blood chemistry, because all internal functions are going to be negatively impacted when you have a chronic health condition. Okay, what came first, chicken or the egg? Chronic health condition came because there wasn't things working right, and it was left to go before it showed up as being bad, okay? So by addressing the problems that with your thyroid and the other areas, you're going to heal faster, okay? Sensitivity testing. This is a big one. This test determines if you have a sensitivity to gluten. Okay, gluten is in wheat, rye, oats, and barley. We also look at milk. We have some new testing that we do now, so it's a little bit different than this, but it's actually it's more complete. If you have a problem with any of those foods and you're eating them, you are creating a major problem. Okay. Most of the neurological or most of the symptoms that we see with the gluten sensitivity are not gut. So everyone thinks, well, if I can eat bread and it doesn't bother me, then obviously I don't have a problem with it, but that's not true. It's very far from the truth, actually. The biggest problems that we see with gluten sensitivity are neurologic. The biggest one we see is peripheral neuropathy. You have diabetes as well, so those kind of overlap, but the other one would be just brain type symptoms, headaches, migraines, brain fog. Okay? So some of the symptoms that we see with sensitivities, again, chronic pain or fatigue, frequent indigestion, bloating, loose bowels, because when your body doesn't like a food, it wants to just get it out of there as quickly as possible. Again, that's where you see the fibromyalgia patient. Most of them are autoimmune thyroids. Okay? Constipation, mouth ulcers, and vomiting, because the body doesn't like that food. So the only way to find out if you're suffering from any of those sensitivities is to do the test. All right, if you don't do the test, then you don't know. We also do something that's called an adrenal stress index, and with that we do a hormone panel. The adrenal glands sit on top of the kidneys, they're your stress glands. They also are a way that your body helps to regulate your blood sugar. So if you have a blood sugar regulation problem or you have any insomnia, you definitely want to look at that, okay, because it's so important. We do a saliva test that tests that. So when your body's cortisol levels are abnormal, you're going to have a problem with insomnia for sure, and with blood sugar regulation. We look at some immune panels. We look at initially the CD4 to 8, which tells us, are you dysregulated or do you have that active immune pattern that we talked about earlier? Again, we want to see that because we want to see, number one, what side are we probably going to have to do more work on? What direction should we go in? And secondly, we want to be able to go back and retest it when we've done our protocols to see if it's come into a normal range again. And that way we know that we're on the right path. If it's still out there, then we know that there's still something there that we haven't found yet, and we have to keep looking. Immune panels, T B lymphocyte, natural killer cells, cytokine, all of these things have to do with how your immune system works. And we normally look at these a little bit later on. We start with doing this. But as we get more involved, we can look to see whether you're what's called Th1 or Th2 dominant. And that gives us an idea of what things we may need to eliminate from your intake, things like vitamin C or caffeine or certain substances that activate either one side or the other we want to keep you away from. That's the simple way of saying it. Again, when we want to determine the active antigen dysregulation is the CD4 to 8. Active antigens are going to be things like parasites, bacteria, virus, mold, yeast, fungi, protozoan, food chemicals, and heavy metals. All of these things can cause an active immune response in the body. And when we see that CD4 to CD8 ratio above 2.0, we know that there's something like that creating the problem. Okay, and that's kind of a place for us to start at. I go with 2.0, I don't even use the 2.5. I go 1.0 to 2.0. Okay? So, if you're suffering from an autoimmune disorder, obviously it trumps everything else that we do. As far as priorities go, it's the #1 priority. Once that is calmed down, if you didn't have an autoimmune disorder, we'd be looking at things like blood sugar regulation is, anemia is #1, because it's oxygen. #2 is going to be blood sugar regulation. 3 is going to be gallbladder, and 4 is fatty acids. One of the big things that we see with our thyroid patients is H. pylori. And what is that? It's the most common bacterial infection in the world. It can live in the stomach. It can also live in the small intestine. But remember, when you have a thyroid disorder, it creates a problem where your stomach's not making as much acid as it should, and it creates this little window of opportunity for H. pylori just to come in and set up shop there. This is a huge driver of cardiovascular problems, okay? Big one. If you have H. pylori that's not being taken care of or eradicated, you increase your chance of cardiovascular incident, okay? So we run, we can look for this in the stool, but we can also do a urea breath test. If we come up with it in the stool, then I don't run the breath test. If it's negative in the stool, then I'll run it. Because either way, the treatment is the same, I just want to know where it's at. And I want to make sure that you don't have it because it is so common and it does have a big cardiovascular risk to it. And if you have a problem here in the stomach, if this hasn't been taken care of, this is kind of like, if you're at the castle, it's kind of like the moat. If people can get by here, just kind of sneak in, you can get all kinds of problems in the bowel because this isn't right. Part of the reason, or the existence of your stomach is to make acid, okay? And it makes acid because that's what breaks down food. It has to be acidic enough to turn on enzymes to break down the different types of food that we eat, the carbs, the fats, the proteins. And it's also there to make sure that if you eat something that isn't right, that has E. coli or a parasite or something in it, that it's going to get killed here before it passes down into this area. When you have H. pylori, your stomach isn't acidic anymore. It raises the acidity, or it raises the alkalinity. When the stomach is alkaline, it doesn't make the right enzymes, you don't break down food, and your food rots in there. And it ferments and it creates acid reflux or that kind of burning, heartburn kind of feeling. And it's not because your stomach is making too much acid. It's because the food is rotting in there because you're not getting it broken down. Okay? In addition to that, when you eat the bad food, when you're off at Jack in the Box or wherever, eating that burger, it's got E. coli all in it. If you were healthier here, if everyone that was exposed to E. coli got it, then that would make sense. But not everyone who eats the burger gets sick, right? Why do you think that is? Because some of those people have a bad gut. Some of those people are really alkaline and it allows the bacteria to come in, and the rest of them have a good working stomach that's killed it before it became a problem. Okay? H. pylori, very, very problematic. Intestinal permeability. We see this extremely regularly as well because most Hashimoto's or most thyroid patients are Hashimoto's, and all Hashimoto's patients have gluten sensitivity. If you've had it for any length of time, your gut's going to be leaky, which means you're going to eat things, and instead of them, the nutrition being extracted and that food passing down into the colon to go out, things leak through, big protein particles leak through into your system, and then your body reacts to them and creates antibodies. And then you become sensitive and reactive to all kinds of stuff that you eat regularly, and that's not good. Plus, it becomes like a breeding ground for inflammation, and that's not good either. We see that also because when you're autoimmune, most likely your vitamin D is really low, and vitamin D is what holds the junctions together to keep it tight in there, and when there's not enough vitamin D, they'll loosen up and things will leak out too. So most people that we check autoimmune-wise are around 20. The